The Cubans were our main task. We have Cubans working and living here in Freetown. We have Cubans working and living around Waterloo, and we have Cubans working in Carytown, and then we have Cubans working and living in Port Loko. This is actually the original IHP project, why IHP deployed to Sierra Leone in the first place, because a lot of foreign medical teams are coming in to assist in fighting the Ebola, and of course they all need a place to stay, and outside Freetown it's very difficult to find accommodation. And because of the lack of appropriate accommodation, the Cubans have chosen to stay 2 and 2, so they're sharing a room. And then you can imagine if one of them gets sick, what's going to happen then? Then we need to isolate this person from the rest of the crowd. So that's why we have also brought these Ebola observation units where we can then isolate a Cuban who is suspected of having Ebola, or at least are showing symptoms of Ebola. So the person will be in here until it's determined whether he or she has Ebola or not. The second part of the project supporting the 165 Cuban doctors and nurses is to transport them from their hotels to their jobs every day to the Ebola treatment centers where they're working. And of course we can't take any bus, so first of all we got good quality buses, and then secondly we made sure that it's easy to clean on the inside. So here we have put plastic covers on all the seats, and then the drivers are instructed in how to clean the car in a way that we make sure that there will be no Ebola left if by accident one of the doctors or nurses should bring out a bit of Ebola into the bus.
The support is a 100% support. In the evening, at night, in the morning, anytime. We receive a very good support from your organization.
Work with your body, be with your partner. Yeah. Talk with the partner, ask him.
A lot of the foreign teams that are coming in, they are trained from home or from a neighboring country, but the ones who come in without this training will be trained here, and also the Sierra Leoneans who will be working with Ebola patients will be trained here.
IHP provides logistic support and quite honestly responds to our beck and command, and because of the nature of the emergency, the personal protective equipment, the disposal of those, the delivery and disposal of the equipment, basic needs, food order to, we have trainees coming through this facility and another facility. It can be spread over 2 locations, and they take care of the caterers, they take care of water supply, they take care of the equipment, from clinical equipment as far as lab equipment, clinical equipment like IVs, medicines, and so on. They procure all those things so the trainers can do their jobs with the trainees. So they are quite possibly our backbone in terms of actually delivering our services to the trainees.
It's not enough to train the people in how to protect themselves when wearing the right equipment. So this is what we have built here in IHP. We built this Ebola treatment center in a smaller version, so people can train the flow and also can train what to do where. This is the grounds of the police training school in Hastings. It has been transformed into an Ebola treatment center to which IHP has deployed doctors and nurses. These IHP doctors and nurses, in cooperation with Sierra Leonean doctors and nurses, have improved the layout of the Ebola treatment center so that it's a more safe place to work, but it's also a more safe place to be a patient.
They improved very much our structure.
In addition to that, IHP and the Sierra Leonean doctors and nurses have improved the documentation of the patients and also the treatment of the patient.
Also, communication is increased between patients or staff in the red zone and staff in the green zone. That one also improved a lot our response time.
Which all in all means that this is now a better place to be a patient because you get a better treatment, and it's a more safe place to be a patient and staff as well.
It really helps in bringing down the cases of Ebola.
This is Waterloo Ebola Treatment Center. This was originally a hospital that IHP was assisting in transforming into an Ebola treatment center. What IHP did here was to build the temporary constructions, putting in water tanks, and also supplying other equipment that is necessary for the treatment center to become operational. Due to lack of appropriate accommodation outside of Freetown, IHP has established and is running 2 camps accommodating Ebola responders. One camp is this one in Port Loko that is accommodating 108 Ebola responders. The other one is 4 hours drive from here in Moyamba, which accommodates 60 Ebola responders. Both camps are self-sufficient. That means that we have everything that you can ask for. First and foremost, free Wi-Fi, the accommodation tents, kitchen with the canteen, laundry service, toilet showers, and like a little society, we have our own power plant, and we also are purifying our own water. So all in all, we have established and it's running 2 small villages here in Sierra Leone.
It's great. It's like coming to paradise when you have been to the field and living in other various guest houses out in the country. So this is really a nice place. Here you can get some rest really, and get some good food and charge your batteries a little bit before you go out again and continue to work.
And last but not least, I would like to mention that we are supporting 3 labs, one here in Makini, one in Port Loko, and one in Carytown. These labs are the ones running the test of the blood to establish whether a person is having Ebola or not. And for that, they need a lot of supplies. Some of these supplies need to be kept cold, which means that we make sure that when they arrive in country, from they arrive in the airport till they're actually in the lab, they are kept at this certain temperature that they need to be kept at, so that they will still be functional when they reach the labs. And then we, in addition to that, are doing all the other logistics for these 3 labs. So this was an overview of the big projects that we're involved in. All the smaller ones will be way too much to talk about right now.